Welcome to the Wellness Dentist Podcast. Join biological and cosmetic dentist Dr. Katie Toe as she explores holistic wellness through trending ideas, real stories, and patient experiences. This podcast will inspire you to make healthy lifestyle choices and take charge of your dental wellness. And now your host, the Wellness Dentist, Dr. Katie Toe.
Hi, welcome to the Wellness Dentist Podcast. I'm your host, Dr. Katie Toe, and today I have a very popular demand that Dr. Linty John Vargas coming back to share her wellness journey. Because last time she was here, she was giving us so much knowledge about team wellness and how to get your team get on board on this. However, I know her wellness journey is a book with it, a movie with it. So we want to make sure that she come back and share with us on that. So welcome back, Dr. Linty.
Well, thank you so much for having me back, Dr. Katie.
All the way from Ohio to Austin at Beyond Bio Hiking Conference. What
Best
a better place.
conference ever.
Right?
The reason I love wellness. This conference really defines us.
Yes. We always said one of the non-dental conference that dentists needs to go to is this. Not just for your patient, it's for yourself first.
I literally want to say, I think I can stop going to dental conferences, and I look forward to this conference so much.
Yes, we always learn so much, and then we can implement that into our practice once we test things out and we figure how that works for us too. Right. Yes. So last time, I know that you spent a lot of time talking about team wellness and how to get your team on board. Then I realized that your wellness journey is so wonderful, starting with your personal journey. How did you get there? It's not just recently, but it's been a few decades ago where you said, not today. Tell us the not today story.
Well, I'm going to start with the fact that I've always suffered from different issues from the time I was born. And I've been an antibiotic child all growing up. When they don't know things, what do? They give you antibiotics. They didn't know the diagnosis, and they just treat you with antibiotics because that's the easiest thing to do. The problem with that is you don't treat what you can't diagnose. And I learned that when I was at school. A really great teacher that, her name was Dr. Jahangir. I actually remember her. And I had this really great case, and I was fascinated with it. And I presented it, and she heard it all, took me back, and she says, let me talk to you for a minute. And she taught me, never treat what you cannot diagnose. And that has always stuck with me. And that was about 24 years ago.
24 years ago.
Yes. And it's still, I never forget it. So I always think when I see my patient and I don't know what it is, I opt to refer and do the right thing rather than try to pretend and treat. But the same thing comes back in my life that when I was 24 years old, I was afflicted with malaria, and the malaria complicated to adult respiratory distress syndrome. And the prognosis for that was actually 30% survival, 70% mortality rate. And I was told I won't make it. They tried every remedy, everything they could. And the priest actually came to give me my last rites. And I didn't take it. I didn't take it because I kept having conversations with my God. And I said, I have a lot of life to see. I'm not done yet. I'm not coming today. Not today. I'm not coming today. I said, I'll come another time, but I have a lot of things to do and a lot of things to see. And I don't feel like my life is complete. So that became the reason I had fire in my life, because before the age of 24, I was a very submissive, docile person, didn't have big dreams because I just felt like I was not good enough. And then when I got that second chance in life, I realized that there's more to life I didn't appreciate, and I need to find more about what life holds for me. And so the fire in me started, and more aggressiveness to what does life mean? And where does my life lead me? And the truth is, I've been looking for answers, which was actually not medically related, because not pharmaceutically related to anything. Because I realized that I've been on a lot of antibiotics. It didn't fix anything. Actually, I ended up getting more diseases.
That's right. Your gut probably suffering.
The last thing that got me out of my malaria was after they stopped every single protocol because nothing was working. And I want to say I believe in prayers and miracles, because the last time when they took a chest x-ray and was clear, they stopped all medications for about 6 hours because I was not recovering and they were going to put me on a ventilator. But that proved that there's a bigger force out there than just medicines. And we need to have faith and belief in it. And I really believe God's going to take me through. And the nurses were all astonished by how much willpower I had to live. And I will say, yes, I was determined that I will not die. So it's all in the mind. That's when I knew wellness also was much stronger than any pharmaceuticals. I'm not saying pharmaceuticals doesn't have a place. Integrative medicine is important because if you have a heart attack or you break your bone, I'm sorry, we cannot pray that away. You might try, but I can't tell you how much it'll work. So I do think medicine, surgery, things that you need is necessary, but there's so many ways that you can treat it without it. You don't have to have a chronic disease. You can actually help it with using what's missing in your body versus let's treat it with medications. And I will say, just as medicine has a place, let's say you have diabetes. Maybe you need insulin. How about we get you better and then start changing your life so you can now tone down your insulin and see if your liver, your pancreas, everything will start getting better. And I know this just from my own parents. My dad was a diabetic for 55 years. And towards the end, when he did pass away, it was very hard for me. And it was watching him in the last few years that he was staying with me, I realized I don't want to live like that. I don't want to be in that position he's in. I don't want to live on insulin. And everybody in my family on my dad's side had diabetes. And
Everyone on your dad's side?
Every single person. I have 27 cousins, my uncles, my aunts, my grandparents. Every single person has diabetes except for my sister, brother, and I. But we're all very mindful of what we eat. We don't eat rice as much as we have in our
You all
culture.
in healthcare also.
We're all in healthcare.
Yeah.
Everyone's realizing more and more that as much as they're in a medical profession, that's not always the answer because they themselves are changing to organic foods and being mindful and not using Teflon and not using things that's causing toxins to our body. If they can be mindful of that, that means they already know there's something more.
Oh, yeah. There's tons of research on that.
Right.
Yes.
So they stand with their medicine, but in their own personal life, they're actually practicing what they preach. And they don't realize that because medicine has sown it in their brain that if you don't use medicines, you can't work. You can't.
It's like brainwash, right?
Pretty much.
Yes.
Pretty much. Yes. And so my family is seeing more and more of what I am doing. And I feel like they are slowly swaying the pendulum to my side, but they were also taking care of themselves way better. So none of us are diabetic, which is pretty amazing because we're all past in our 50s right now. And every single time we take the blood test, we cringe like, who's going to get it first? And none of us have it. And so that just goes to say how our diet, our mentality about how things should be doesn't have to be in a certain way. We can change it if we believe it, but we're actually doing our part. So that became the theme of how I wanted to live my life. And then the more I learned about wellness and it started coming into my life, I realized my patients needed it too. And the second, I realized patients don't need dentistry. They need to be understood and they need to understand what's going on with their body because dentistry is any dental symptom, anything you have in your mouth is honestly a symptom. It is not the reason you have it. It's not like no one's brushing the teeth or maybe you're not flossing, but flossing is not everything. You're brushing your teeth. You're doing what you need to. You're tongue cleaning, you're oil pulling, you're doing all different things and it's still not adding up.
Yeah.
That's when they know, when they come to us, the wellness dentists, the ones that's seeking more, they're so relieved when they know there's a reason that they're having those symptoms and it's not their fault. And when you spend time to listen to things like, I don't start from where the problem is. I listen to them, but I tell them, let's go backwards. Let's go back. Let's go so far back. I said, do you remember how you were born? Well, no. What did your mom tell you? Were you a cesarean baby? Were you a full-term baby? Did you breastfeed? Did you have trouble breastfeeding? Did you have trouble talking when you were young? Did you sleep well? Do your kids sleep well? The more questions I ask about them, whether it's their kids or them, sometimes they don't know about themselves, but the positions their kids in, they're sprawlers. They do like little ninjas all around their bed. There's a likelihood they got it from their parents. The parents just didn't know. Mm-hmm. But the more I dig, it's so fascinating that they are fascinated, but I learned so much more about them. And that fills their heart because someone's asking them about their past, but I'm trying to connect their past and their now. And that is what really gets them through the other side. That listening, that someone's actually paying attention to you, that someone really cares to want to know. I literally said, did you have any falls? Did you put any contact sports? Did you anything? No, I'm a very safe person. Well, you are. I said, did a cup hit your teeth? Did a fork hit your teeth? Oh, I don't think so. Did anybody headbutt you? Did your elbow? Were you playful with your siblings? Suddenly it triggers and jogs their memory. And when they say that, they're like, that did happen. Well, how did you get those root canals in the front? I don't remember. Every time I went to the doctor, they said something's wrong, and I got a root canal. I said, you don't remember any injury. But the more I dwell and I go backwards, seeing if they have any past accidents, if they had any injuries, sports injuries, if they were roughhousing with their siblings, that was the answer. But that made them feel happy. Because now they had an answer, because I said, everything in their mouth, there's a reason. We just have to dig for it. I said, if I don't help dig for the answer, whatever I do will fail.
Yeah.
We need to find you. Who are you? Let's bring you forward so that when we're trying to treat the mouth, you'll heal because you know where it came from.
Yeah. I know people don't understand that, first of all, we're all patients.
Sure.
Yes. So we have our own wellness journey that we're going through, and we are making progress every day. Some days are easier and some days are harder than the other. Knowing and being one of your really close friends and seeing how heartbroken you was when your dad passed away. I know that when you're looking at that, you said you saw it coming. You saw it coming with his diabetes for 55 years.
Yes.
And you just said that you and your brothers and your sister did not have diabetes. No. So that's reinforced the fact that your gene is not your destiny.
No, it's not.
And people need to hear that. You're going to say that to the patients and the people that are listening here, because a lot of patients come into practice and say, I have bad teeth because my mom lost all her teeth, or my dad didn't have good teeth. Yes, your gene was given to you, but it's not your destiny. That's why we have epigenetics. We can use lifestyle to change what gene expression is going to be in your generations and even your children's generation. You have even more time to do that. So what do you say about seeing what's happened with your dad for 55 years, and now you are helping and take care of your mom who's dealing with cognitive decline, right? Mm-hmm. Memory, dementia issues. I know your motivation is strong, but you're like, I don't want to be like my dad or my mom. What you do differently in your daily life now that you will bring it into the practice? Like more testing, more, I would say, preventions, because dentistry, in a way, we kind of seek care. We wait for the teeth to break. We wait for a patient to lose bone around the gum. We wait for the patients to have bleeding, right, or infection to do something. Because the rest of the time, people are like, I have no pain. And I'm sure with your dad, with 55 years, especially on insulin, he didn't feel pain.
No.
But it's breaking his body down over the decades, right?
Mm-hmm.
What you doing differently in your practice now that you didn't do it before you practicing wellness dentistry?
I'm going to say that I really focus a lot on oral hygiene is still king. I'm not going to take that away.
Yeah.
Like, no one realizes that the gum bugs that you have are affecting their memory, their heart, their diabetes, and it's actually there on the genetic panel. When
you can see them.
We can see them. And even if you do a saliva test in the oral DNA, we can see those markers, those bacteria are present. So that's almost when I see that, and I see it in my own, if I take a saliva test and I see it, I'm like, oh my goodness, I have that that's going to cause it. I need to be better about my techniques of whether it's flossing and brushing and oil pulling and having more deeper bacterial reduction therapy, everything with ozone, everything that I can do to help myself. Because if I can't help myself, how can I help my patients? You have to put your mask on yourself before you put it on anybody else to help them, because you have no clarity otherwise. So I do my job as what I need to, as a human being, as me being my own patient. But then it all starts from what's in your gut. Mm-hmm. What do you put in your mouth, whether it's the foods, the hydration? What do you do to mentally give peace to yourself? Even today, being at every place I'm going to, and I was in the sound bowl, and it is so funny. There were so many people around, and I could sit there in the sound bowl, and the clarity was so great that when that sound, the hertz was actually obstructing all the noise, and I could actually go from sympathetic to parasympathetic to where I could hear my thoughts, and I felt peace. And we need that to even reset the genes in our body, the stems, the cells that need to become the next cell, the stem cells that's trying to grow. We can change it by simply being better about, whether it's the nutrition we do, whether it's the mental, the works that we do, whether it's meditation, whether it's journaling, whether it's sauna, cold plunge, and just reading more about it, because you can learn a lot about, instead of experimenting, let somebody else tell you what happened in their life. I like learning that. And then I try to use little things. Remember, you can't do everything. You write it down somewhere because it's difficult to remember all that you said, everything you are. So I try to bring little things that I see from my friends. When they do it, I learn from what it is that you have gained. Let's say you have become better for just practicing that. And I'm like, maybe I should try it. So I learn from my friends who are also trying different things. We share, and then I put it in my practice. I try it on myself, and then I advise it to my patients. Yeah. And when I can tell them what I felt, then they believe it. Rather than, hey, try this. I think this is good. I think this is what you need. No, I always start with my story on how it helped me. And I do tell them how my parents have issues and medical conditions, which I wish not to get. And so I changed my life. And I try to practice better.
So you focus on preventions, and that's how you bring into practice the prevention's key, which is extra testing. Mm-hmm. And, I still feel funny that patient thinking, I need to see dentist every 6 months, because that was a toothpaste commercial back in the 1920s when people said, oh, if you go to dentist every 6 months, you're good. But I have patients that need to go see us every 30 days. The one that have chronic diseases, autoimmune, survive a heart attack, or having cognitive decline rapidly. They need the mouth to be really in great shape because it's the beginning of the gut, and the gut affecting the brain, gut-brain axis. And thinking that they're asking me questions like, I thought I got to see you every 6 months. I'm like, not in your case. It's personalized. And so I know seeing your dad and of course, taking care of your mom, the frequency that people talk about, 3 months, 6 months, even 3 months to some patient is too long. Mm-hmm. Could they not be able to take care of what they already have in the mouth? Because not everyone have virgin teeth. People have crown, have root canals, have implant made of titanium, implant made of ceramic. They're all different in material and different reactions in the mouth. So I know you have the microscope, the phase contrast microscope, saliva testing. Mm-hmm. You also do ozone therapy, and then laser therapy. You have a very powerful laser. Actually, the Photona company is downstairs. And so we have a lot of tools, and I think that a lot of patients think every dentist are the same. Mm-hmm. But in reality, the knowledge, awareness, knowledge, and also technologies are different. Like Dr. Sean Drake was just here earlier, and he was telling about the difference between practitioner and healer. And I think a lot of dentists ready to be a practitioner, right? We're practicing dentistry, we make mistakes, and then we learn. But I think when you step into the role of a healer, it's no longer just the physical body. You're asking the questions about, their childbirth and what is their physical state or emotional state or a spiritual state when you're seeing them as a patient. So what I notice is you're taking what you see in your personal life and you applied it into your practice. And then, of course, your team just follow because they see it. They see with their own eyes that you're practicing that every day.
You're right.
Yeah.
Absolutely.
For the patient that in your practice already, what do they say when they see those changes?
They're actually very happy. They actually come looking for it. I'm very, very pleased to say that our wellness patients are so educated. Uh-huh. They do their own research.
They take ownership, right?
Yes, 100%. They come with all intention to get better. Mm-hmm. They learned and studied on their own. Yes, they're confused. They think everything applies to them, but everything does not apply to them. We just have to separate what they need to do and what is not relevant to them. It's not that it doesn't exist. It's just they don't need it. And so helping them, guide them through that journey where they don't need everything actually makes them feel better, rather than when you go to a doctor, you go somewhere else, you need a whole bunch of things. No, I would say, you don't need that. Why are you taking the supplement? I said, are you lacking in it? And they're like, well, I don't know. I said, did you do a blood test? Well, I didn't know there was a blood test. And so that's when I educate them about functional medicine provider.
You're closing the gap. Yeah.
I am. I said, you need to know the building blocks. I did my blood test. No, I said, you did a basic blood test to make sure that everything is normal on the surface level after the injury. I said, we're going to go down to the foundation and start seeing where those gaps came from that led to the injury. So I said, let's start from the bottom. And that makes sense to them when they realize that we're missing their minerals or their vitamins or their hormones are messed up. And how can we punch those holes and make them complete so that they can start healing from the bottom up? And so even when they come in, they have nothing on their teeth. They've got beautiful Colgate Crest teeth, and they're proud of it, but they also notice very slightly they have gum recession, but they don't even think about it. And as soon as I see their teeth, I said, wow, you have beautiful teeth. But I said, but you have airway issues. They said, no, I don't. I said, well, you have recession. Let's have a look at it. And so when I showed them their teeth on an intraoral scanner, they're amazed that there's actually the recession that they have, or they have a cervical lesion, like an abfraction. And when I tell them they're clenching and grinding and it's coming from their airway, they're shocked because they were always so pleased with it. And then they suddenly notice that, yes, their gum's receding, but they've never, ever thought about the fact they have an airway issue. But they feel relieved that there's something else besides the fact they're not taking care of the teeth, because they took such great care of the teeth, which is why they have great teeth.
Yes.
But opening up their eyes to that, they're so grateful. So I love my wellness patients. They are so happy.
And they love you too. I can tell. Yes.
They make me happy. Like that, the fact that they know, and whenever they know something more than me, I said, tell me.
Yes.
Tell me. When I ask them, they're so pleased that as a dentist, I'm asking them, like, who do you use? Tell me more about it. What are you doing?
Yeah.
It's not that everything has to be used, but I use the information they give me. Let's say they go to a provider that really is giving them good service, and I reach out to them and I try to be their patient. I realize, wow, I have one more person to help my patient. And as we all say, it takes a village to teach another about what we do. But once we all decide and realize that we can help one person become better, even one person, wow, isn't that amazing? Can we actually, literally, I can say, go to heaven because we did one good thing. It's just one good thing, but we have one person.
Yeah. And that person, you know what, will be able to share that knowledge with others.
Yes.
And so not only that we see that in, say, patient refer patients, but we see that their friends getting better, the family coming in, they're getting better, the parents. I have a lot of patients with, I need to really bring my parents because they should not, stay in the sick care, especially you do anything for your parents and your children. We know that. So a lot of time what we're doing for ourselves is maybe sound like, yeah, I do it because I'm not feeling good. But the moment you figure things out, you start sharing. You cannot not share because you're like, people can see it's different.
No, yeah.
People can see your energy. People can see like your team. That's why they believe in what we do, because they see it, they witness it every day. I think that when you're just lecturing to them and you don't really walk the talk, people know. And patient know. Remember I told you the story that patient come in and they said, I switched dentists because my last dentist was not healthy. Well,
right.
Patient have the right to judge, and they're going to judge, patient going to judge you, people going to judge you anyway. So why not living that best life, the wellness life that you've been talking about? And I know it's not easy.
No.
Yeah, between practices, family life, this is a busy season for you, and you're still making the time to go to Beyond by hiking and doing this for yourself. That's a big commitment.
Yes, there's so much from just this conference that I can bring back to my patients, and it just makes me so happy. But even listening to Dr. Katie's lecture today for the audience, wow, the response was tremendous.
And these are really educated patients, right?
It made my heart happy because they were all raising their hands and they were so interested. And I'm like, see, these are people who want to change their lives. It doesn't stop at, let me find, I found the answer. They're like, no, let me be better. They're walking around every single thing trying to say, how can that help me? What can make me better without having to take medicine, without having to be sick? How can I make my mental acuity better? What can we do to help us physically? What can we put in our body to nourish us? And the care that every single person here has taken time to come out here and do, I'm just so impressed with the audience and everybody who's also behind the vendors. Outstanding. The education, they are really not bored with the amount of people that ask them the same questions. They actually take so much energy and courage to be the same enthusiasm with each person.
Yeah, because they know, it's just like us, when we heal our patients, we know that person would not stop thinking about talking about it, and we'll share that knowledge, and together we can really changing our healthcare system, which is we call it sick care.
Yeah.
But what we're doing is try to bring healthcare to that sick care system to really help the patient that want to get the help. Like today you said in the room, everyone raised their hand and say, I want help. Because they're ready. They just didn't have the information before. And so we want more and more dentists like you to share the journey and share the story. And I love the fact that you are so good on social media to share and educate the public. Educate the public and sharing what you're doing for yourself. That video was at 4 million views on Instagram.
It's almost 5.
Almost 5 million views on Instagram now. And it was something that you do for yourself.
I did.
As a patient.
Open to it. I thought, sometimes things scare us because we're not familiar. But you have to be very open and let that energy flow through you. And if you don't allow it, and if you look for a block, and sometimes I talk myself out of things, and I listen to myself as I'm talking, I'm thinking, wait a minute, I'm being my own block.
Most of the time,
here.
yes.
I didn't come here to talk that person out of what I should do. That person's trying to help me. And I said, stop. I said, I'm so sorry. Let's restart. Tell me how you can help me. And then when they come through me and channel through me, I feel that energy. But I had to be open. When I'm trying to make excuses why something won't work, it won't work. You're right when it won't work, and you're right when it will.
Yeah. Yes, I think the first step, a lot of people asking me, how do I know which provider or which healers are right for me? And this always go with the energy. How do you feel the energy? How do you feel after meeting them? We always tell patients that you at least have a visit or consultations or a new patient exam with the medical, with the chiropractor, with the acupuncturist, like anyone that you want to work with after you met them. Like a lot of times social media is great, got to know about you, but then when they see you in person, what the energy that they get from that meeting. If it's a positive and say, this is the person that's going to take care of me, I said, lean in and go for it, right? But if you were like, no, I don't think this is right, I'm not ready, there's nothing wrong about that. And I promise you, none of us going to get offended if you're like, you're not the right fit for us.
Yes.
We actually want you to really lean into that instinct and that gut feelings and that intuition because it had to be a match. You had to be ready. Just like Dr. Sean Drake was here and he said he fired patients on day one. Because the patient was not willing to do the work or is not ready to enter that healing journey. And I think that's kind of strange to hear. But for the people in this community, I think that's what they're so used to.
No, I agree. But I'm going to say it kind of goes both ways. Just as they're feeling our energy, we're feeling their energy.
Yeah.
Just
It's
like
like a
you
date.
said.
Yeah.
Right. And sometimes we have to make the choice to let them go because they're just not the people that should be aligned with you.
Yeah.
And
Or
that's
they're not ready
okay.
at this moment.
Right.
Yeah.
Right. They're not. So they're finding reasons to block their own path because they know better or they're just not ready for us. And sometimes it's difficult for us to realize that we can't help them. But if we can realize for ourselves that it's best to let them find the person that aligns with them, that energy is not right for you, you got to let them go. Just like we know that they have to also decide that we are the right providers for them. So I always tell them when I send referrals to my fellow providers who are also doing great jobs, but I said, I'm going to send you to someone. And I said, they're really great from what I understand. But I said, it should feel right to you. So it feels right to you, please continue. If it doesn't, please let me know. Because the truth is, don't force it on somebody. Make sure that they feel that match. And we're doing the right thing for them.
We always talk about the 80-20. So 20% when you find the right healer, provider, you get the right diagnosis, you get the right care. But then 80% still with the patients are what they're feeding their body, how they sleep, what their stress level, right? And all of the things, hydrations and environment, who are also the one that stress them out. Now, not just the stress that they created on themselves, mostly deadline and projects and works and responsibility, but also the people around them stressing them out. And so those are the things that the provider or the healer have no control over, can guide them and say, this is what I see, that you have high stress level right now. How can we lower that? Let your healing kicking in or your parasympathetic. But I think a lot of patient don't realize that all they focus on is getting into the best provider that they can look for, but then forget that the 80% success are with them. How do they commit it to go on this journey? Because I've seen a lot of patients that, I go from this doctor or this provider to the next healer to this provider. And that to me is like either you haven't found someone that a right match or you're not committed. You're not committed to discipline, to double down, to bet on yourself and to bet on that provider and say, I'm going to try to follow that protocol. And let's see if it's worked for me. And I also see the opposite where people listen to all the people protocol and blindly follow and realize that it didn't work for them later on and then thought that it's not going to work for anybody. So I think in this calling, we call the calling, it is quite complex. Like yesterday, Dr. Arthur Brooke from Harvard University was talking about, we try to solve something so complicated, but then healing is a very complex issue, right? We're thinking if we do the red light, if we do the cold plunge, if we do the supplement, if we're doing this shot, it's going to help us to get to health and wellness. But health and wellness is, a lot of that is more than just the physical. We talk about spiritual, emotional. And seeing you going through this in your personal life and implement it into your practice, it is a great reminder for dentists that listen to the show, knowing that it's not another technology. It's not a CE. Oh, by the way, if you want to know what CE course to take, Linty have a huge, collections and review called Linty List that she will tell you, if this is the right course for you, what you're expecting. It's because she's always the one learning. And so I think a lot of dentists thinking it's the next toy, it's the next technology, it's the next CE course, and don't understand that wellness is a lot more complex than that. Unless you're ready to get on that journey to take care of the patients, I think it's going to be a shock for a lot of people entering this wellness and thinking that it's going to be 1 + 1.
Right.
Yeah. And so thank you for answering the calling, because I know it's called you. It's called you to serve. It's not something that you're like, oh, I want to learn another thing. You're just curious and you lean into it. But I know that it's called you. Do you feel that?
I did. I mean, I'm going to say it has to be at the right time. It somehow gravitates towards. It just suddenly, sometimes you don't realize you're confused till you meet the source and then you realize that's making sense. But so what was I doing? And that curiosity of being okay to understand that we did all we can and learned all we can, but knowing that there was more out there and we don't know what we don't know. Even when my patients are there, I said, let me explain to you how this begins. I said, this is a journey we are both on together. You don't have to be a dentist to understand dentistry. But if you don't understand dentistry and how your body costs that dentistry, I said, then we're going to have a problem with this. I'm not asking you to do the dental work, but we can both see what's going on.
Yeah.
And I said, just have patience. Listen to your story and let me show you a story and show you what happened to your mouth, because your story, and you're going to be fascinated how what you just told me is on your tooth as an evidence-based history from the past, and now it's on your tooth. And if I show that to you, you will be baffled and amazed with how this is a record of your past life. And sometimes little things like that is enough. But just that way, when you said, how did I come to wellness? That was actually the journey. My journey was me discovering more things. And I started discovering and I realized, wow, I need to change my life. And the second I started changing my life and I saw the results, then I realized, wow, I can help my patients more than just science. Use science and use your body's own biology and response and your mental acuity. You have to pay attention to where are you actually. Not just, I learned that. No, but where are you with that information? Process it. Take a minute. It's okay to be confused. But take a minute to say, let me just think and sit with it.
Yeah.
Maybe sit with that instead of having to learn it and do it. I like to do stuff. You know that. But sometimes you should take a minute to sit with it and see how it applies.
I know. We have both patients and dentists listen to the show. So first question, if they dentists and they said, man, I love the first episode with Dr. Linty, talk about team And now I see her journey and I really want more guidance or have conversation with her and ask a question about what technology or CE course should I take? Or you have a patient that, you want to have some guidance. How do dentists reach out to you?
They can reach me on Instagram on Dr. Linty. I think that's the best way to reach me. If otherwise, you can reach me through my office. It's Ohio Holistic Dental Center. We have email if you get to the website, and if you put a message out to me, I will see that too.
Yes, and to patient, I know she have a long wait list. I know, I hear that all the time. However, you want to be Dr. Linty patients or asking her question or meet her team, how is the best way for patients to reach out to you?
Definitely the website. The website's
the
most
practice
helpful
website.
because having a little information about where you're from, what you're looking for really helps us at least understand if this is a time to come in, are we the right people for you? Then we'll call up, give you more information about what we do, and then do a little interview to understand where is it that we can help you rather than bring you in and not decide this is the time. We'll kind of coach you through the phone calls that we have with you.
And one thing I want to remind you, if you work with Dr. Linty as a dentist or a patient, remember she's going to hold you accountable. There's none of us can do things for you. We can figure things out, give you the correct diagnosis, give you a game plan, and guide you on this journey and cheer on for you.
No,
but you and I have to do the work. So make sure that you take the ownerships of your health, because if not, who else, right? And we're here to telling us that we take ownership of our health. And we walk this talk every single day. You can ask our team, ask people in our community. We have a huge community of the wellness dentist community. Yes. And so join us. Make sure you follow Dr. Linty on Instagram at Dr. Linty. And of course, Ohio Holistic Dental Center.
Correct.
And we definitely will bring Dr. Linty back because, she has so much wellness knowledge and a wealth of knowledge to share with us. So thank you, Linty, for joining us all the way from Ohio today in Austin at the Beyond Biohacking Conference.
Thank you for having me.
Yes. And don't forget to subscribe, and we see you at the next episode. Thank you for listening today. Wellness starts in your mouth and includes your entire life. When you understand that, the whole game changes. Come learn more at thewellnessdentist.com. We see you in the next episode. And remember, there is always a reason to smile.